Hello, my friends. Dr. Adam Carter here, and welcome back to Seniors Life Health, your trusted source for staying healthy and comfortable as we age gracefully together. Now, before we dive into today's incredibly important topic, I want you to imagine something terrifying for just a moment. Picture waking up tomorrow morning, and your eyes feel like someone poured sand into them while you slept. You blink, but instead of relief, it feels like sandpaper scraping across your eyeballs. You reach for eye drops, but nothing seems to help. The burning, the stinging, the constant irritation. It's there when you wake up. It's there when you're trying to read the newspaper. It's there when you're watching your favorite TV show. And it's still there when you try to go to sleep. This isn't just discomfort, folks. This is your quality of life slipping away, one dry, irritated day at a time. And here's what might shock you. This nightmare scenario is becoming reality for millions of Americans over 60 every single day. But here's the thing that really keeps me up at night as your doctor and friend. Most people don't realize that untreated dry eyes aren't just uncomfortable. They can lead to serious vision problems, chronic pain, and even permanent damage to your precious eyesight. The eyes you've relied on for 6, 7, 8 decades or more could be crying out for help right now, and you might not even know it. Last week, I had a 73-year-old patient come to my office. She could barely drive herself there because her vision was so blurry and painful. What started as just a little eye irritation 3 years ago had progressed to the point where she was considering giving up her independence entirely. The tragic part: this could have been completely prevented. Today, I'm going to share with you everything you need to know about preventing and managing dry eyes and irritation as we age. By the end of this video, you'll have a complete action plan to protect your eyesight and maintain comfortable vision no matter what your age. And folks, if you've ever experienced that gritty, uncomfortable feeling in your eyes, please hit that like button right now. It tells YouTube that this information is valuable, and it helps us reach more seniors who desperately need this information. And make sure to subscribe to Seniors Life Health and ring that notification bell. Let me start with a story that changed my perspective on dry eyes forever. Margaret, a 68-year-old retired teacher and grandmother of 5, walked into my office with tears streaming down her face, not from sadness but from pain. "Dr. Carter," she said, "I feel like I'm losing my mind. My eyes burn all day long. I can't read to my grandchildren anymore because my vision gets blurry after just a few minutes. I can't drive at night because every headlight feels like a knife in my eyes. I feel like my independence is slipping away, and nobody understands how much pain I'm in every single day." Margaret represents a hidden epidemic affecting millions of American seniors right now. Here are the numbers that every person over 60 needs to know. Over 16 million Americans have been diagnosed with dry eye disease, but experts believe the actual number is over 30 million people suffering in silence. By age 65, approximately 40% of men and 60% of women will experience significant dry eye symptoms. By age 75, those numbers jump to over 50% for men and nearly 70% for women. If you're a woman over 75 watching this video, there's almost a 70% chance you're either dealing with dry eyes right now or you will be very soon. Your eyes produce tears constantly, not crying tears, but a complex mixture of water, oils, proteins, and antibodies that form a protective film over your eye's surface. This tear film has 3 critical layers: the oily outer layer that prevents evaporation, the watery middle layer that provides moisture and nutrients, and the mucous inner layer that helps tears stick to your eye. When any of these layers aren't working properly, you develop dry eye syndrome. It's like trying to use a car windshield without windshield wiper fluid. Everything becomes scratchy, cloudy, and unsafe. Here's what's truly frightening. Untreated dry eyes can lead to corneal abrasions and ulcers, essentially cuts or open sores on your eye surface. They can cause serious eye infections when your natural tear protection is inadequate. They create progressive vision problems, including permanent blurry vision and dangerous glare sensitivity. They can develop into chronic pain syndrome, where your eyes hurt constantly, and they often lead to social isolation and depression. Margaret had developed significant corneal damage from 3 years of untreated dry eyes. She was at serious risk of permanent vision loss, all from a condition that could have been prevented. But here's the good news that might save your vision. Everything I'm about to share with you has helped thousands of my patients go from constant eye misery to comfortable, clear vision. Stay with me because the next section could change your life. Now I want to share Robert's story. This 72-year-old retired mechanic had been dealing with severely dry, burning eyes for over 2 years. He'd tried various treatments without success and was becoming increasingly frustrated. When we went through his complete history, we discovered a perfect storm. He was taking an antihistamine for allergies, a diuretic for blood pressure, and an antidepressant, 3 medications that can all cause dry eyes. He also had undiagnosed meibomian gland dysfunction, spent hours in his dusty workshop, and his diabetes was putting him at higher risk. Once we identified all these contributing factors and addressed each one, Robert went from constant misery to comfortable eyes within 6 months. His case proves that dry eyes in seniors usually have multiple causes working together. Let me explain the age-related changes first. As we get older, our tear-producing glands gradually produce fewer tears. Research shows tear production can decrease by 60% between ages 18 and 65. But it's not just quantity, the quality changes too. Tears become less stable and break up more quickly on the eye surface. Hormonal changes are huge, especially for women. During menopause, estrogen and progesterone decline dramatically. Since estrogen receptors are found throughout the eye and tear glands, when estrogen drops, tear production often follows. This explains why many women first notice dry eyes in their 50s and 60s. Men aren't immune either. Testosterone levels naturally decline with age, and testosterone helps maintain healthy oil glands in the eyelids and supports tear production. Now here's the big one that most people don't know about: medication-induced dry eyes. Many medications that seniors take can significantly reduce tear production. Antihistamines for allergies are probably the worst culprits, including Benadryl, Claritin, Zyrtec, and Allegra. Antidepressants, particularly older ones like amitriptyline, can dramatically reduce tears. Blood pressure medications, especially diuretics or water pills, remove fluid from your entire body, including tear production. Decongestants, pain medications, sleep aids, and anti-anxiety medications can all contribute. The crucial point is never stop necessary medications without medical supervision, but be aware of these side effects. Several medical conditions increase risk significantly. Diabetes can damage nerves controlling tear production and affects 50% more people with dry eyes. Autoimmune conditions like rheumatoid arthritis and Sjögren's syndrome directly attack tear glands. Thyroid disorders, rosacea, and chronic eyelid inflammation called blepharitis all contribute. Let me explain something most people have never heard of: meibomian gland dysfunction. These tiny oil glands in your eyelids produce the outer layer that prevents tear evaporation. As we age, they become blocked or don't function properly. The oil becomes thick like paste instead of flowing easily. When these glands don't work, your tears evaporate immediately, even if you're producing normal amounts of the watery part. This affects 85% of people with dry eyes, yet it's often overlooked. Environmental factors make everything worse. Air conditioning and heating remove moisture from the air. Computer use reduces our blink rate by up to 60%. Air pollution, wind, smoking, and low humidity all increase tear evaporation. Now here's what 90% of seniors don't realize. There are simple daily habits that can prevent most of these problems before they start. The prevention strategies I'm about to share have kept thousands of my patients comfortable for decades. Don't go anywhere. Prevention starts with daily eye care habits, just like brushing your teeth prevents dental problems. The 20-20-20 rule is crucial if you use any screens. Every 20 minutes, look at something 20 feet away for 20 seconds. When we focus on screens, our blink rate drops by 60%, and blinking spreads tears across the eye surface. Conscious blinking exercises sound simple, but work amazingly well. Most of us don't blink completely when concentrating. Several times daily, do complete, deliberate blinks. Close your eyes gently, pause for 2 seconds, open slowly. Repeat 10-15 times. Do this when you wake up, before meals, and before bed. Establish morning and evening eye routines. Morning, gently clean eyelids with warm, damp cloth. Do 15 complete blinks. Use preservative-free artificial tears if needed. Apply sunglasses when going outside. Evening. Remove all eye makeup completely. Clean eyelids with warm compress for 5 to 10 minutes. Do blinking exercises, keep bedroom humidified. Environmental modifications make huge differences. Maintain indoor humidity between 40–60%. Most homes have much lower humidity, especially in winter. Use humidifiers in rooms where you spend the most time. Place water bowls near heating vents. Keep houseplants that add natural moisture. Avoid directing fans or air conditioning at your face. Optimize your lighting. Use soft, indirect lighting for reading. Position screens slightly below eye level. Avoid glare by positioning screens perpendicular to windows. Ensure adequate lighting to avoid eye strain. Clean air is crucial. Change air filters regularly. Avoid high pollution when possible. Don't smoke or spend time around smokers. Use air purifiers if needed. Keep windows closed on high pollution days. Nutrition plays a direct role. Omega-3 fatty acids are the most important nutrients for preventing dry eyes. They reduce inflammation and are crucial for high-quality tear production. Eat fatty fish like salmon, mackerel, sardines at least twice weekly, or take fish oil supplements, providing 1,000 milligrams combined EPA and DHA daily. Include anti-inflammatory foods, leafy greens like spinach and kale, colorful vegetables like bell peppers and carrots, berries, especially blueberries, green tea, turmeric and ginger. Essential nutrients include vitamin A from sweet potatoes and carrots for tear production, vitamin C from citrus fruits for eye tissue protection, vitamin E from nuts and seeds, zinc from oysters and pumpkin seeds, and vitamin D from fatty fish and sun exposure. Stay properly hydrated with at least 8 glasses of water daily, more if you're active or in hot weather. Limit dehydrating beverages like alcohol and excessive caffeine. Eat hydrating foods like cucumbers and watermelon. Monitor urine color. Pale yellow indicates good hydration. Quality sleep is essential. Aim for 7 to 8 hours nightly. Keep bedroom cool and humid. Use blackout curtains. Ensure CPAP masks fit properly if you have sleep apnea. Consider bedroom humidifiers, especially in winter. If you take medications that cause dry eyes, work with healthcare providers to minimize impact. Never stop prescribed medications without medical supervision, but discuss timing adjustments. Ask about alternative medications with fewer side effects, and be extra diligent about other prevention measures if you must continue problematic medications. Here's something that will shock you. There are simple home remedies that work better than many expensive treatments, and most doctors never tell you about them. What I'm about to share next has transformed thousands of my patients' lives using things you probably already have in your kitchen. Let me tell you about Helen, a 78-year-old avid reader who had given up books completely due to severe dry eyes from Sjögren's syndrome. Using the natural remedies I'm about to share, combined with proper medical care, she was back to reading 2 to 3 books per week within 8 months. The most effective home treatment is warm compresses, especially for meibomian gland dysfunction affecting 85% of dry eye cases. Here's the correct method. Use a clean washcloth soaked in comfortably warm water. Apply to closed eyelids for 10–15 minutes. Gently massage eyelids in circular motions while compress is in place. Do this once or twice daily. You can also make a rice sock by filling a clean sock with uncooked rice and heating it in the microwave for 30 to 60 seconds. Proper eyelid hygiene is crucial. Use mild tear-free baby shampoo diluted with warm water. Gently scrub along the base of eyelashes with clean cotton swab. Rinse thoroughly with clean water. Do this every morning and evening, always after warm compress treatment. Hydration goes beyond just drinking water. Maintain optimal hydration with at least 8 glasses daily. Increase if you're active or in hot weather. Include hydrating foods like soups and water-rich fruits. Monitor urine color for hydration status. Environmental modifications provide immediate relief. Use humidifiers to maintain 40 to 60% humidity, especially during winter when heating systems dry the air. Use air purifiers to remove irritants like dust and chemical pollutants. Avoid strong cleaning chemicals, air fresheners, or scented candles that irritate sensitive eyes. When outdoors, Protect eyes with wraparound sunglasses from wind and UV radiation. Diet modifications can naturally reduce inflammation. Include fatty fish rich in omega-3s like salmon and mackerel, leafy greens like spinach, providing antioxidants, colorful vegetables like carrots and sweet potatoes for beta-carotene berries, especially blueberries for anti-inflammatory compounds, nuts and seeds, particularly walnuts and flax seeds for healthy fats. Limit processed foods high in trans fats, excessive caffeine and alcohol which can be dehydrating, and high sugar foods that increase inflammation. Several natural supplements show promise. Omega-3 fatty acid supplements with 1,000–2,000 mg daily of combined EPA and DHA have strong scientific evidence. Evening primrose oil may help improve oil gland function. Flaxseed oil provides alternative omega-3s for those who can't take fish oil. Some find relief with herbal teas like chamomile or green tea for their anti-inflammatory properties. Always consult healthcare providers before starting new supplements, especially if you take blood-thinning medications. Gentle eye exercises stimulate tear production. Do slow, deliberate, complete blinks 15 to 20 times, several times daily. After warm compresses, gently massage eyelids in small circular motions from inner to outer corners. Practice the 20-20-20 rule as a form of eye exercise. Try palming, covering closed eyes with palms for complete darkness and relaxation. Stress reduction significantly impacts tear production. Chronic stress affects tear production and worsens symptoms. Practice deep breathing exercises for 5 to 10 minutes several times daily. Try meditation or mindfulness practices. Consider gentle yoga or Tai Chi for both physical activity and stress relief. Ensure adequate quality sleep, as poor sleep increases stress on your body. Sleep optimization for eye health includes establishing consistent bedtime routines, turning off electronic devices 1 hour before bed, keeping bedroom cool, dark, and at optimal humidity, using bedroom humidifiers especially in winter or dry climates. If you use CPAP machines, ensure masks fit properly to prevent air leaks near eyes. But what happens when natural remedies aren't enough? The advanced medical treatments I'm about to reveal can restore vision even in cases where people thought they'd never see clearly again. These breakthrough treatments are available right now, and most insurance covers them. When natural remedies aren't providing sufficient relief, medical treatments offer powerful solutions. The most common first-line treatments are prescription anti-inflammatory eye drops. Cyclosporine, sold as Restasis, reduces inflammation in tear glands and increases natural tear production over time. It typically takes several months to see full benefits. Lifitegrast, marketed as Xiidra, works differently by blocking specific inflammatory proteins. Both are used twice daily for long-term management. For severe cases, there are additional options. Prescription artificial tears may be more effective than over-the-counter versions. Short-term corticosteroid drops provide quick relief from severe inflammation, though they're limited due to potential side effects. Autologous serum drops made from your own blood serum contain growth factors for severely damaged eye surfaces. Punctal plugs are tiny devices inserted into tear drain openings in your eyelids. They work like bathtub stoppers, preventing tears from draining away too quickly. There are temporary plugs that dissolve over time and permanent silicone plugs. The insertion procedure is quick and painless, done in the office. Most people don't feel them once in place. For meibomian gland dysfunction affecting 85% of dry eye cases, advanced treatments include intense pulsed light therapy using controlled light pulses to reduce eyelid inflammation, LipiFlow treatment applying controlled heat and pressure to clear blocked oil glands, tear care using flexible heaters for thermal pulsation, and meibomian gland probing to physically open severely blocked glands. For very severe cases, surgical options exist but are rare. These include salivary gland transplantation, temporary eyelid closure called tarsorrhaphy, and amniotic membrane transplantation for severely damaged eye surfaces. Working with the right healthcare providers is crucial. Optometrists often provide comprehensive dry eye care, and many have specialized training. Ophthalmologists are medical doctors who can perform surgical procedures, and some subspecialize in eye surface diseases. Look for providers who take comprehensive approaches. Ask detailed questions. offer multiple treatment options, and coordinate with your other doctors. If you have underlying medical conditions contributing to dry eyes, treating these is essential. Diabetes requires excellent blood sugar control to prevent nerve and blood vessel damage. Autoimmune conditions may need immune-suppressing medications. Thyroid disorders need proper treatment to optimize eye health. Rosacea treatment with antibiotics can reduce eyelid inflammation. You should see an eye care professional if symptoms persist. Despite consistent home remedies for several weeks, symptoms are worsening over time. You experience sudden vision changes. You have severe pain or signs of infection. Dry eyes significantly impact daily activities, or you have underlying conditions like diabetes or autoimmune diseases. Treatment is often most successful when individualized to your specific situation and when multiple approaches are used together. Your provider should consider your age, gender, medical conditions, medications, lifestyle, and environment. Regular follow-up is important to monitor progress and adjust treatments. Be patient. Many treatments take weeks or months to show full benefits. Now here's what separates people who get better from those who continue to suffer. Knowing how to manage dry eyes in your daily life. These practical strategies I'm about to share will help you maintain your independence and continue enjoying everything you love to do. Let me bring this all together with practical daily life strategies and real success stories that prove recovery is possible. For reading, ensure adequate lighting without glare. Position material slightly below eye level. Take regular 20-20-20 breaks. Use preservative-free artificial tears before reading and during breaks. Consider large print books or adjustable e-readers, and don't give up. Audiobooks can provide relief when needed. For computer and screen use, increase font sizes, reduce screen brightness, use dark mode when available. Position screens slightly below eye level. Take frequent breaks. Blink consciously and completely. Use artificial tears before extended sessions. Consider anti-reflective coatings on glasses. For driving, keep artificial tears in your car. Use sunglasses during the day. Clean windshields regularly to reduce glare. Avoid directing air vents toward your face. Keep windshields clean inside and out for night driving. Consider anti-reflective coating on glasses. Never ignore vision problems while driving. For shopping and errands, plan for less crowded times. Bring artificial tears for air-conditioned stores. Wear glasses for protection from air currents. Take breaks during long trips. Consider online shopping for regular items. For travel, pack plenty of preservative-free tears in carry-on luggage. Stay well hydrated and limit alcohol and caffeine on flights. Use tears more frequently during flights. Bring small humidifiers for hotel rooms. Research destination climate to prepare appropriately. Dorothy's success story. At 69, she came to me barely able to drive due to severe dry eyes lasting 4 years. She had meibomian gland dysfunction, was taking multiple contributing medications, and had chronic eyelid inflammation. We switched her allergy medication, started prescription cyclosporine drops, established daily warm compresses and eyelid hygiene, added omega-3 supplements, and used preservative-free tears throughout the day. Within 6 weeks, she noticed improvement. Within 3 months, she was reading comfortably again, and at 6 months, she said, "I feel like I have my life back." Robert's transformation. This 72-year-old diabetic mechanic had severe symptoms for 2 years. We optimized his diabetes management, started prescription lifitegrast drops, addressed his dusty workshop environment with better ventilation and safety glasses, treated his meibomian gland dysfunction with LipiFlow, and established strict home care routines. Within 2 months, his comfort improved significantly, and within 6 months, he was working comfortably for hours. Helen's recovery. At 78, with Sjogren's syndrome, she had given up reading entirely. We coordinated with her rheumatologist, used autologous serum drops, inserted punctal plugs, performed intense pulsed light treatments, optimized her reading environment, and taught proper break techniques. Though improvement took longer due to her autoimmune condition, within 4 months she was reading 30-45 minutes at a time, and within 8 months she had rejoined book clubs and resumed library volunteer work. These success stories share common themes: comprehensive treatment, addressing all contributing factors, patient commitment to following treatment plans consistently, Patience as treatments take time to show full benefits working with knowledgeable healthcare providers. The importance of simple home treatments done consistently, and that environmental and lifestyle modifications are often as important as medical treatments. Your action plan starts today. If you're experiencing warning signs like gritty feelings, burning, excessive tearing, eye fatigue, blurred vision, or light sensitivity, don't ignore them. Begin prevention strategies immediately, including the 20-20-20 rule, conscious blinking exercises, proper eyelid hygiene, optimal hydration, and environmental modifications. Start home remedies like warm compresses and preservative-free artificial tears while arranging professional care. Schedule comprehensive eye exams with experienced providers. Work with all your doctors to optimize health and medications. Be patient and persistent with treatment. Don't let cost concerns prevent seeking help. Stay connected with support systems. Keep learning about your condition. Remember, dry eye syndrome is not something you have to accept as normal aging. It's a real medical condition with serious potential consequences, but it's highly treatable when approached correctly. Early intervention is always better than waiting until symptoms become severe. You deserve comfortable vision and the ability to continue enjoying all your favorite activities. Don't let anyone minimize the impact dry eyes can have on your life. If providers aren't taking your symptoms seriously, seek second opinions or find specialists with more experience. The future looks bright with new treatments being developed, but don't wait. The strategies and treatments available today can provide significant relief for the vast majority of people with dry eyes. Take care of those precious eyes. They're your windows to the world and deserve the best care possible. If you found this information valuable, give this video a thumbs up and share it with other seniors who might need this help. Subscribe to Seniors Life Health for more vital health information. Until next time, this is Dr. Adam Carter, wishing you clear vision and comfortable eyes. Remember, you don't have to suffer with dry eyes. Help is available, effective treatments exist, and with the right approach, you can maintain comfortable vision for years to come.